Good morning. It's nice to be here again, and I'd like to thank the trustees for inviting me here. There was a question from the top there from the chap who was in his 40s who had asked whether frequent, I think the word you wanted to use was ejaculation, frequent ejaculation prevented prostate cancer. And I had a discussion with Nada afterwards, and I said there was some evidence that frequent ejaculation does actually reduce the risk of prostate cancer. And that must mean that most of my patients are not wankers. So I just want to clear that up. But it's funny, you know, when you have these types of topics, humor does help. But it's interesting. Nada rang me yesterday at about 10 in the morning, or 11, I think it was, and he said I sounded sleepy. I was actually trying to have a day off, and there were multiple phone calls, and his was one of them. And he said, I know what you've done. You've dropped the kids at school, you're having a nookie with the missus, and I've just interrupted you. And I said, no, Nada, I'm just going through my slides for tomorrow, and I fell asleep. So, but then overnight, I was obviously thinking about this talk. You know, you turn up here and you try and look as calm as you can, but actually you're quite nervous because you're in front of a whole bunch of people. And I had this funny dream, and I was in a bicycle race. And everyone was decked out with their fancy gear and their fancy bikes, and I had this rotten bike. And I crashed into something. I don't know what I crashed into, but I must have been thinking about Mike, because Mike's all into the fitness. But then I must have woken up, and I felt a tickle down below, and I must have been thinking about Rosie King at that time. But what I realized was, in fact, my bladder was full. But luckily, I hadn't wet the bed. If I could have my first slide, please. So what I've got to talk about is female bladder issues. And some of the things I'm going to discuss will be relevant to men as well. But mainly we want to focus on some of these female issues. As was mentioned before, these are the organs that we deal with in urology. Just a schematic there of a kidney on either side, which filters blood and then produces urine, which runs down those little tubes into the bladder where we store the urine, and then we expel it when we urinate. And obviously with women, we have some slightly different organs there. We've got ovaries on either side and a uterus, and most importantly, no prostate gland as such. Now, Nada did allude to some of these things, these lower urinary tract symptoms. So when you come to see one of us or see your GP and you're discussing these issues, these are the sort of issues we want to run through with you. And basically, it's not that complicated. It's that cycle of having finished passing urine some time earlier. The bladder slowly fills, so you get that feeling of wanting to urinate. And in some people, I'll discuss some of those issues today, where that feeling can become terribly urgent and unnecessarily frequent. And slow and variable stream is more common with men with prostate problems, but some women also get that, and that could be due to some abnormality within the system. Same with dribbling. We often think of men with prostates and slow streams, as Nada showed you on that graph, but women get it too. But these are basically the cycle of voiding. And I've added bleeding, even though that's not a typical symptom when we think of lower urinary tract function. But sometimes some of you with a condition in the bladder or the kidneys may pass blood, and that can be quite alarming, and that's something you would not ignore. I put this picture up because, as you do when you prepare for talks and you look for pictures, and I discovered a shiwi. And a shiwi is something that a woman carries in a handbag and allows her to pee in a public toilet. It's quite a novel little thing. I've never seen that before. And obviously that was picked up on Top Gear at one point as well. I don't know what the discussion was there and what it had to do with cars, but there it turned up in Top Gear. Let's look at the bladder again. So remember the little kidneys at the top, they produce urine, we store it in the bladder. Our sphincter muscle, which is that muscle that's a ring muscle that stays tight and stops us wetting ourselves, is closed, the bladder fills, and then when we want to pass water, the bladder contracts, that muscle relaxes sideways, and the water runs out, and we can empty the bladder, and that's the way it should be working. However, there are a few little things that can bother us. One of them is an overactive bladder, and all of us have suffered with an overactive bladder at some point. I'm currently suffering with that right now, which is that I would have urgency, hopefully not urgent incontinence, which is where I leak, but urgency when it gets really strong, that desire to want to pass your urine gets so strong that you are unable to suppress it. So if I had a strong urge right now and I could not suppress it, I'd have to leave the stage and try to void. Now, if I ran a small business and I was a mum and dad type business and I had to run the shop, well, I couldn't keep leaving every once in a while. If I had manned the front desk, I couldn't do that. If I was a surgeon, as I am, operating sometimes for hours on my feet, I can't be running to the loo all the time. So it does affect us, because if we can't suppress the urge and we leak, it becomes a significant issue. Daytime frequency, this is when we're passing our water just a little bit too often. Every hour, every second hour, it's getting to be a little bit of a joke, and we're starting to void too often at night. So we're now not sleeping properly either. So what we tend to do is we ask about that frequent urge to void that can't make it to the toilet. So sometimes you get the urge, but you actually can make it, but just in time, and that gets a bit close for some people. And this can be a problem for many of our retirees who are traveling. You hop on a plane, and next thing there's turbulence, and you can't go to the loo. And it might sound funny, but it can be quite embarrassing. The leak can be very small, so you're just aware of something on your underpants, and that's just a bit annoying, or it can be very large where it comes through the clothing, and that can then affect how you even dress. And once you get up at night too often, it just gets a bit tiring. If you look at incontinence, which is what the term we use where leakage occurs, and that can be on this left-hand side, stress incontinence. And stress incontinence is when we cough or sneeze or make a sudden positional movement and we leak, and women do suffer with that. That group's there. Urge incontinence is another group, and urge incontinence is what I've just been talking about, that strong urge that you can't suppress. And then urgency and frequency, which is going often but not quite leaking, but becoming bothersome. And of course, mixed groups. Overactive bladder is part of that whole symptom complex in some way. If you look at age groups, this is the risk incidence over here on the left-hand side, and the age groups. You can see that male and females, by the time we get into our 70s, it's about a third of us that are suffering with overactive bladder, so it's very common. How it happens, we actually probably don't really know, but what we know is the bladder seems to become oversensitive or overcontract or a bit twitchy, and that sets us off, and we try and hang on by the base of the bladder where we try and keep the bladder dry, but the bladder becomes a little, I guess I used the word twitchy. You just feel like you need to go all the time, and you're not quite sure why that's happening. But on a more serious side, as these things take hold, they do become a real problem. And if you think about it, you'll realize how much of a problem they can become. You can start to develop pressure ulcers because of moisture, unnecessary moisture. You can start to get a nasty rash, like a nappy rash that babies get. You can start getting all sorts of skin infections, sometimes urinary infections. If you're getting older and you're not moving as quickly as you used to, you can actually stumble and fall and even sustain a head injury. So it is becoming then a serious thing. Oh, fall and break your hip, and then it really starts to affect your quality of life. So jokes aside, when this thing gets serious, it does get very serious. If you take it a step further, this is the stuff people won't talk about, or sometimes they'll tell us, but they may not tell anyone else. They may become aware that because they leak, that they think that they can smell something, and to them it's as real as anything. You and I might tell them we can't smell anything, or sometimes we can, but sometimes just the fact that they believe they can smell something will start to really disrupt their social activity. They won't go out, they'll stay at home, they'll develop potentially low self-esteem, depression. It'll start to limit everything they do. If they're a bit younger and still working, it might actually affect their ability to work, and if they're older, it might actually lead them into a nursing home. So it does become a very serious problem. In terms of how we assess people, we always take a history. That's just chatting to them, getting some of the relevant facts. We might examine them for things that might lead us to understand why these things are occurring. A urine test is always helpful because sometimes there's infection in the urine, and that's what's setting it off. A bladder diary is something we ask them to keep in telling us how the bladder works, just like when you go to a dietitian, they'll ask you to keep a food diary. And interestingly, in this age of the electronics, there are apps on your phones, for those of you who have smartphones, where you can actually record these things on your phone as you go. That allows us to assess symptoms. We sometimes like to keep bladder charts where we get you to fill in a chart where we ask you to tell us every time you empty your bladder and how much you do empty each time to give us a cycle, avoiding. And sometimes we do blood tests because there are other conditions like diabetes that you may not know you have that might be affecting your bladder. And we check the flows and how much you might leave behind because sometimes you may not be emptying your bladder very well. I put this up just to remind me that there's a whole bunch of reasons why you might get a twitchy bladder. So in terms of what we mean by local pathology, something in the bladder like an infection or bladder stones or a growth in the bladder. In terms of metabolic, that's sort of the way our system runs in the body. Sometimes we're just drinking way too much. I mean, some people are drinking 6 liters a day. Now, if you're going to drink 6 liters a day, your bladder is going to play up because you're pushing a lot of fluid through. Diabetes can upset your bladder. Sometimes medicines of various sorts, including fluid tablets called diuretics, can push through too much fluid through your bladder, and we use them often for blood pressure and fluid retention. And other things that are listed there, including alcohol and caffeine. I think we sometimes forget that in this cafe latte culture that sometimes we're drinking just way too much coffee. And that comes up over and over again. I think that's become a real problem in our society with people drinking a lot of coffee because it can actually upset your bladder. And here I just list, without having to go through that, just to be aware that sometimes medications, including some blood pressure tablets called ACE inhibitors, that can make you cough. So you might think the cough's not so bothersome, but the problem is the cough's brought on the leakage issues. In terms of where we start with treating this, well, we always recommend that you start with your GP, whether it's your prostate problem or your bladder problem. But we're very lucky, as has been mentioned. The Trust has trained about 15 nurses in the community. We have nurses in our practice. And what they do is they help us educate you on some of the conservative things, like what are called pelvic floor exercises. These are not exercises you do on the floor. These are exercises you do on your pelvic floor. You can stand and do them if you like. And we educate you about how your bladder works. And there's no shortage of books to help you and websites. These are not the best photographs of our 2 nurses. I'm sorry about that. This is Marilyn Turner and Ann Doyle, and they lead our nursing team at the Urology Center and have been responsible for training those 15 nurses as well. And their role is really just to get back to basics, look at what sort of garments you're wearing, shields, pads. Women often gravitate to sanitary pads when they first leak because those are the pads they know, but those pads are not ideal for urine leakage. And that's often the first thing we would do. Just getting the right sort of pad advice makes all the difference. And we know this one because you see them in the ads. They're running around on the beach when they get the right pad because happy wife needs happy life. Never quite understood that one. I don't know why they have to run on the beach after they find the right pad, but that's what they do. And we have behavioral modification. This is just basically educating on all the little things that we can try and work out, because sometimes it's dietary issues that might be setting it off, or just exercises that you could be doing. Then we look at the things that are setting it off, and there could be medications, there could be the coffee, tea, alcohol issue, and then we progress down a list of treatment arms that we could offer, but most of the options, most people get better with some of the conservative treatment and medicines. The medicines are fairly good, but they do have problems, so we can sometimes gravitate towards using medicines that just reduce the bladder's twitchiness, that desire that you get of frequency and urgency. But they do have side effects, and some of these medicines are not on the PBS, which means that they are a little bit more expensive because they're not on the cheaper list. In older people, they do affect memory, and sometimes we're a bit cautious. If someone is, say, in their late 70s, we don't like using these medicines. Some of those other side effects are not as big of an issue. But I think we do have a problem with these medicines because it is known that up to half of the people that get put on them will stop them. And that's probably because of side effects, and sometimes in this country because of cost. I put this up to remind me that for many years now, we've been using in the cosmetic industry Botox, which is used to get all those crease lines out, and it used to be just the movie stars, but everyone's using it these days. And it's very safe, but what it does is, the reason why it works in cosmetic medicine is it stops us sort of frowning and getting those wrinkles, and therefore helps us stop aging at some level. But we can also put into the bladder, because what we're doing there is placing it into parts of the bladder where we can stop the bladder twitching. So we put a little telescope in the bladder while you're asleep, and using the natural water pipe that's there, and we can put a tiny little needle and have multiple areas of the bladder where we inject into the muscle of the bladder, and we can stop those little parts of the bladder twitching, and therefore by that just relaxing your bladder a little bit and taking that urge out. Other fancy things we can do, we can put little electrodes into your back attached to like little pacemakers that can actually stop the nerves that are driving your bladder crazy and just slow things down a little bit. And through the quirk of how we're put together, by putting little electrodes into your legs, sometimes we can retrain your bladder as well. This is all coming to us in the near future. The other one is urinary incontinence. So it does come into it a little bit, because when you get an urge and a leak, well, you leak, and that's urinary incontinence, where basically the simplest definition is that you leak urine when you don't want to, when it's not appropriate. Again, similar sort of things come up, because if there's an involuntary loss of urine, it develops into a social and hygiene issue for yourself. If you start using pads, you may be using the wrong pads. There may be a cost involved in that. But I guess these are things we don't talk about, in that if you have urine leakage, it is possible that you may have fecal incontinence as well, and that's something that people don't often volunteer. But from a quality of life perspective, you can imagine how devastating that would be. And of course, we don't talk about this either, in that if a woman thinks she has an odor, or if she thinks she's leaking inappropriately, and sometimes she doesn't know how much she might be leaking at what time, she might start avoiding sexual contact because of that reason as well. And sometimes you have to ask about that, even though it can be a little bit embarrassing, but the number of times you ask and people say, yes, that's why I'm avoiding it, can be very sad if that's what's happening. And women do have what's called prolapse disease, where the vagina can just have weaknesses from childbirth usually, and some of the organs that the vagina supports start to drop, like the bladder. In terms of incontinence, we define it in a few ways. It's getting a bit technical, but overflow incontinence is where your bladder gets so full that you don't feel it anymore. Sometimes if you've had a stroke or a spinal injury, your bladder gets so full you just leak urine because it's just literally got 2 liters in it, and you haven't emptied it all. Stress incontinence is where I cough or sneeze and I leak because my sphincter muscles down below can't control the pressure. And urge incontinence is what I've been referring to, that sort of oversensitivity where the bladder just wants to keep tickling along. This is prolapse, where the bladder, here's the water pipe downhill, and basically the bladder drops. See that little V-shaped defect? And the bladder drops and leaks urine, and that's an example of a prolapse. Again, we can treat with behavioral management. It's surprising how much you might think that behavioral management won't work, but it actually works really well. We can look at the things that might be setting it off, then use medicines, and then start progressing down the path, if required, to those other treatments. Here is another thing called a cystocele. This is a bladder. The front of the body is there, the back's there, the back passage is here, and the bladder is dropping into the vagina, and that's called a cystocele or a prolapse. Now, many women who are older will have that with no symptoms at all, and that's not a big deal at all. It's only if it becomes related to urinary function that it becomes worth treating. This is called a flexible cystoscope, where we have this little fancy little flexible telescope that we can pass into the bladder just with using a little bit of anesthetic jelly, and we can inspect the bladder very carefully, and you can walk in and walk out and have that inspection done just to work out where everything is. This is a little bit more involved. Sometimes in people who leak urine, we can pressure test the bladder, where we put a little tube in the bladder, fill it with a solution that we can see on X-ray, and then measure the pressures of the filling and emptying cycle of the bladder. If we come to repairing things, this is again the front, this is the back, this is the bladder. We can put little things called slings. They're little tapes made through 1 centimeter incisions, and therefore not big operations. These sort of operations you can have on it as a day procedure, where it just supports the bladder and stops it dropping, which then would set off the leakage. And there's another example of the bladder. This is actually more male urethra, and again a sling is through there to stop leakage. Other things that if you look up a water pipe with a telescope, which people like Nada and I do all the time, this is getting to the neck of the bladder, and the dark spot which doesn't have any light is the bladder because the light hasn't got in there yet. And this ring structure should be closed, but it's open, and that's why it's leaking. So sometimes through that telescope we can pass a little needle and put these little cushioning, bulking agents in there to just close it. Think of a donut and just making that donut a little bit fatter. And what we're doing there is we're just trying to close that to control leaking. Sometimes we unfortunately have to resort to catheters. These are these little tubes that sit in the bladder. We can use a little balloon to stop it falling out, and we drain it to a small bag, either through the tummy or through the urinary passage, because we just need to get the urine out. If I move briefly now to urine infections, this is a picture of bugs in the bladder, and these can be very bothersome. Basically, a bug gets in the bladder, and it causes the bladder to become very red and raw and very, very uncomfortable. The things that you might feel would be sometimes, just out of the blue, you'll start going often. You might sense a lot of pain down there, whether you have the pain all the time or whether you have the pain when you're passing water. You may pass blood. You may even pass pus if it's getting really bad. You sometimes get very sick and develop a fever, and sometimes that infection can go all the way to your kidneys. Although sometimes you can have no symptoms and still have a urine infection. It's not it's not a sexually transmissible disease. Urine infection is not that, but a lot of people think it is because It is related to intercourse in many cases. The penis going in and out of the vagina can milk bugs back into the bladder, and if you don't empty the bladder afterwards, that can set up an infection. That can be related a little bit to estrogen with aging, and sometimes there's a structural issue. So hence the caption, "Not tonight, I have a sore toe." Because what she knows is that if it happens tonight, she's going to have a bladder infection tomorrow. We treat infections with antibiotics, sometimes short-term, sometimes long-term. We sometimes use investigations like ultrasounds to see that's a bladder there. That's all the dark stuff's the water in the bladder. And sometimes, as I mentioned, we pass little telescopes into the bladder just to look for things that might be setting off the infection. And naturally, if we find a cause, like a stone somewhere or a structural defect, we try and treat the cause. And coming back to basics, one of the things that do matter with infections is that if your bladder can empty adequately, if there is a precipitating cause, that you just empty the bladder after that, like after sexual activity. And if you're wiping yourself, it would be reasonable to wipe yourself front to back rather than the other way around. So I hope that was a nice thumbnail sketch of these issues. I'm happy to take any questions, but I'll leave you with that thought.